insurance in its pure sense is a risk management tool that provides finance transfer. So you transfer the risks associated with the cost of healthcare to a third party, and we call that third party an insurance company, right? So insurance basically was created to actually respond and help clients deal with major medical issues. So it's critical to have insurance because not everybody and most people probably will not have the financial needs in case of an emergency or when medical conditions arise. If we were to really sit down and think through the consequences of when we eat and what we eat or consume, and we were to logically and soberly, I must say, think through how that impacts us. And not only while we're young, because in a lot of cases, we take a lot for granted while we're young, make certain assumptions, and then we see the consequences as we age. But as it relates to trans fat increases the risk of things like cardiac arrest, and which leads to death, obesity. We hear stories of many people who have cardiac conditions, episodes, strokes, hypertension, and the impact that it's having on our community. What insurance does is it actually then provides a financial mechanism for an individual, for families, for communities to actually be able to take care of the medical costs associated with their treatments. I know there's a drive by the NCD Commission to encourage our communities and our families to live healthier, more fulfilling lives and make responsible decisions around consumptions and behaviors as well. It's not only consumptions, behaviors. Just think about tobacco smoking, right? So if we can live healthier lives and we actually are disciplined around wellness in terms of our individual selves and our families, it would have a direct impact. I mean, a real direct and significant impact on the cost of insurance, because insurance is around pooling. So what we do as insurance companies is simple. All we do is we take the population that we insure and we say, if we collect $100, we expect that $100 to look after the healthcare needs of the 50 people that pay the $100. It is as simple as that. So then we hear population and people saying, well, insurance is always going up, because there's a direct correlation between the cost associated with healthcare and the cost that has to be borne by the pool which the insurance company manages, right, for the population that it is serving. So one way to treat with that, but the best way to treat with that, is to really think through what we're consuming, what we're exposing ourselves to, so that we can actually reduce the cost of living. So we hear a lot about the cost of living. We have a responsibility. Each of us have a responsibility. And if we think through the decisions we make, we can actually reduce the cost of living to an extent that in some cases might be manageable, because we have a part to play. We see a lot of cases where the treatment is not available locally, or the best treatment may not be available locally, whether it's in Barbados or the region. We tend to look around the region to see if treatment is available, and where the treatment is not available, persons have to be treated outside of Barbados. Now just think about it. Not a lot of people think through the costs associated with treatment in terms of you are paying Barbados dollars in premium, but your treatment may require a US dollar expense. Just think about that. So you have doubled the cost, right? If you look at the basic exchange rate that we tend to apply, say, to the US dollar. That in itself impacts the cost of insurance for everybody, because the cost of your treatment is shared by the entire pool. We actually are trying to work with our various stakeholders and constituency and policyholders to ensure that we build out preventative care and wellness programs. That is critical for us. Now, if you look at the incidence and the severity of the impact of transfer as it relates to cardiac issues, hypertension, diabetes. Again, when you're young, you may get away with it because we're physically active, you have a lot of energy, and it takes time for illnesses and issues to develop. But we're seeing too many people late in their 30s and 40s are now coming down with major issues because for the last 20 years, we've actually been doing things that we thought we could have gotten away with, right? So those things actually, once we do those things, you will see a reduction in the need for the medical insurance to respond to minor issues, and you leave it in place for when you really have a major issue. And that is what insurance is about. Insurance really primarily was there or is there to treat with the major issues when they occur, and not some of the ailments that we're seeing now with respect to poor diets and that type of stuff.